this is Dr. Steuben. I'm presenting my next session on Newborn 101, and I have some information about self-care for you and baby. So the take home is you've got this new baby, but we still need to have you take care of yourself, right? Because the more rested you are, the better you are going to be taking care of a newborn. And let's face it, a lot of people have other kids with newborns. So if you can find some time to just spend for yourself, a short time to get some rest. But the take home is it's okay to ask for help. You know, it takes a village sometimes. And so if dads, parents, family members can kind of help you out, sometimes it's okay to let them help you out. Another good thing is when you do have other children, it's a very interesting transition from being maybe king of the castle or princess of the universe to having another sibling. And so sometimes having some time with your other children by yourself so that they have some one-on-one time with them can be really helpful. And all kids do adapt to having new siblings, but sometimes that can be smoother if you set aside some time each day for that previous king of the castle. One more thing to bring up that people don't like to necessarily talk about is postpartum depression. And postpartum depression and anxiety is very common. Sometimes it's not even with your first baby, so it doesn't have to be an experience-only thing. We do try to screen people multiple times until 6 months of age, for baby that is. And the take home is it can kind of pop up whenever. And some of the signs and symptoms are baby crying for no reason, feeling like you're not good enough, anxiety, or just straight up fear. We can help you with those things. So please, if you're finding that you're having symptoms in that area, or maybe a family member brings it up, because sometimes it's hard to recognize that in yourself. But if somebody's seeing that, we need to hear from you, because treating postpartum depression is incredibly important. And no previous history of anxiety depression is needed for that. It can just pop up. Now, if you do have a history of anxiety depression, well, then it may be exacerbated. And the take home is the medications that we use are safe with breastfeeding, and they just make you happy, healthy, and ultimately we want you to enjoy this baby in the safest way possible. Some normal things for babies are rapid breathing or periodic breathing. That's where they kind of pant and pause. So if you see that in the first 4 to 6 weeks, that's very normal, although it's different from us. And just remember, they breathe a lot faster than we do. In fact, they can breathe up to 60 times per minute. Another little bullet information is that purple hands and feet are very normal. They aren't moving around a lot. Those little babies are just kind of laying there all sweet, but they are not moving that venous blood back from their hands and feet as effectively as they will when they get bigger. So if you're concerned about babies being cold because they have cold hands and feet, check centrally. If they're not mottled and they're warm to touch, that's very normal. Another normal fact is that babies sneeze. They sneeze a lot. Sneezing is how they clear their airway, and since they have a nice fast respiratory rate compared to us, up to 60 times per minute, they sneeze to clear their airway. So if they sneeze and sounds clear, then that's perfectly normal. Doesn't mean they have allergies or colds. It just means they have a bug. So using that normal saline and the bulb syringe and the nose Frida can really help them out if they're persistently sounding junky. If they're not, they're doing their job. One last fact, hiccups are normal. They're not harmful in any way. In fact, they're used to having them in utero, and now that they're out and about, they're perfectly normal. So don't feel like you need to fix the hiccups. They are just fine. Thanks for joining me for this session of Newborn 101. As always, thank you so much for joining us at Tiger Pediatrics.